Yes, sir. We'll have 20 minutes discussion. So in just 3 seconds, we will be live on Facebook.
Should we introduce ourselves?
No, sir, I'll introduce both of you. Okay, sir, we are live on Facebook. Good evening, everyone who have joined us this Tuesday evening for another live session in the Facebook series. So today we have with us a very senior cardiologist, Dr. C Kalmath, and we have with us Dr. Sachin Gupta, who is a consultant nephrologist based at Thane. So today, on the occasion of World Hypertension Day, which is tomorrow, and the World Hypertension Month, we have come up with this initiative known as Tell Me More, which is a dialogue with the cardiorenal expert. Hypertension, which is usually known as a silent killer, it is a common risk factor for both chronic kidney disease and the cardiovascular disease. So this aim of this program is to bring together the cardiorenal experts to share their views and expertise through their thoughts on the Facebook Live. So without any ado, I would like to introduce and welcome our clinical experts for the day. So starting with Dr. C Kalmath. Dr. C Kalmath is a renowned senior interventional cardiologist in India. He's a senior interventional cardiologist at Bombay Hospital, Mumbai, Jupiter Hospital, Thane. He's a professor of cardiology at Bombay Hospital, Mumbai. He holds the position of HOD and director for Horizon Group of Hospitals, Thane. He's a recipient of the Gold Medal Award of Mumbai University for being first in DM cardiology. He's a recipient of Ivan Pinto Gold Medal for excellence in cardiology from Bombay University in 1998. He's a J&J Award recipient for his outstanding work in cardiology. And with more than 25 years of experience in the field of cardiology, Dr. Kalmath has successfully done 60,000 plus angiographies and 25,000 plus angioplasties. We welcome you, sir. And we have with us a highly academic and a young nephrologist with us, Dr. Sachin Gupta. Dr. Sachin Gupta is a nephrologist with expertise in the area of kidney disease, renal transplant, including blood group incompatible transplants, dialysis, which includes hemodialysis and peritoneal dialysis, hypertension, and critical care nephrology. Dr. Sachin Gupta consults at Hope Kidney Care, Thane, and is associated with AIMS Hospital, Dombivli, Jupiter Hospital, Thane, and Reliance Hospital, Navi Mumbai. He is also associated with Jaslok Hospital, Hinduja Hospital, and Wofford Hospital in the past. So we welcome you, sir.
Good evening, everyone.
So we will start the discussion for today. So my first question would be to Dr. Sachin Gupta. Sir, usually hypertension is only considered to be a cardiac disease. Much of importance has been given to the cardiac disease part. So can you just throw a light about how is our kidneys, they are responsible to regulate the normal blood pressure?
Okay. So it is said that kidneys play a central role in the regulation of blood pressure in any human being. So normally what happens whenever there is excess of salt and water into the arteries or the blood vessels in the body, they cause hypertension. So the kidney plays a central role by removing the excess salt and water and thereby reducing the blood pressure and maintaining a steady blood pressure in the body. Second mechanism is usually they secrete hormones like aldosterone or renal, which help in maintaining the blood pressure. So the principal mechanism is removing the excess salt and water, and second is by secreting few hormones in the body.
Okay, sir. So this brings to my next question to Dr. Kalmath, sir. So how does hypertension affect the cardiac outcomes, and what are some of the early signs one can notice?
Hypertension is otherwise called as essential hypertension. Essentially, it's not essential for life. This is a misnomer, actually. Why? Because more than 92% of people suffering from hypertension do not have a known cause up till now. Only about 7 to 8% of the people who have got hypertension have a secondary cause like coarctation of aorta or renal disease or renal parenchymal disease or obstructive renal disease or any excess of steroids or excess of drugs. These are some of the examples of secondary hypertension. The main issue, as you rightly said, is the essential hypertension, which has no obvious reasons found up till now. That's all. We just keep on treating that. Because of that, a lot of people don't know that hypertension is occurring because it's a silent disease, as you rightly said. It is rightly called a silent killer because people having hypertension, blood pressure more than 150/90 for years together do not have headache or breathlessness or giddiness. Is a myth that people get headache due to blood pressure. No, only 5 to 10% will have giddiness or headache in the hypertension. Otherwise, the hypertension for decades can be silent, and that's why it can cause a heart attack suddenly or a LVH and heart failure, what's called as left ventricular hypertrophy, thickening of because the left ventricle is contracting against a higher pressure, causing left ventricular hypertrophy, and even brain strokes, including brain hemorrhages and brain clots, and ultimately, in fact, there are more than few lakhs of patients in India who are being on chronic dialysis because they could not detect hypertension a decade ago. So all these things are deleterious effects of hypertension, uncontrolled hypertension, I should say, which can cause a brain stroke, hemorrhage, heart attacks, LVH, heart failures, and kidney failure. These are important, Anjali.
Yes, sir. So, in line to this question, I would like to ask Dr. Sachin Gupta that how can the high blood pressure affect the kidneys? As sir rightly mentioned, the different stages, how it is affecting the cardiac outcomes. What are some of the ways in which it can affect the kidneys?
Okay. So whenever the blood pressure is high for long, as Dr. Kalmath told, most of the times the blood pressure there is no any symptoms. The patient does not know that his blood pressure is high. So it happens over many years. So a high blood pressure over many years, which basically high blood pressure is that the blood level into the blood vessels or the arteries exert a pressure on the arterial wall or the blood vessel. And if this happens for years together, they gradually damage the blood vessel, the wall of the blood vessel. And gradually over the years, the artery and or the blood vessel weakens. And this weakening and the reduction in the caliber of the blood vessel reduces the kidney function over time. There is ischemia or reduction in blood flow to the kidney, and hence the chronic effect of blood pressure is a reduced kidney function.
Okay, sir. So we come to know the progression of the high blood pressure leads to the kidney dysfunction.
Exactly.
So this brings to my next question to Dr. Kalmath, sir, that there is a term known as hypertensive heart disease, because you have discussed various stages in how it can affect the heart. So there is a term which is specifically for the hypertension. So how do a patient classify that? What are the general stages of the hypertensive heart disease?
No, that's a very important term. That means the deleterious effects of the hypertension seen on heart and vasculature. These are called as hypertensive heart disease, involving not only the important thing in when the blood pressure is uncontrolled, the left ventricle is acting on high pressures, cause left ventricular hypertrophy. That left ventricular hypertrophy is not a normal heart. Whenever heart gets thickened, the blood flow going into the left ventricle becomes very slow and stiffened, what we call as diastolic heart failure. That's what is very common nowadays. It is nowadays called as HFpEF. Heart failure is preserved ejection fraction. People think they come with the echo report saying, my pumping is normal, Dr. Saab, it is 55%. Why do I get breathless? That's because the heart is not relaxing properly. That means the heart, because of the thickening or left ventricular hypertrophy, the filling of the ventricles is inadequate. This is a very important thing. It's a burning issue now, and we have four pillars of heart failure nowadays in form of SGLT inhibitors, beta blockers, diuretics, and ARNI. There's a group of drugs which are very important for, and then leading on to, they can lead into aneurysmal dilatation of the of the aorta, or the descending aorta, or even brain vessels, which can become aneurysmal and rupture. This is the second part, causing brain hemorrhage or vascular aneurysms. And then, as Dr. Gupta rightly put it, that the glomerulosclerosis, that means there is arterial sclerosis, thickening and calcification of the small arteries and big arteries, causing narrowing and reduction of blood pressure, blood flow to kidneys and all the vital organs, causing a renal damage. Whenever there is a renal cirrhosis, kidney makes the blood pressure more higher. This is a vicious cycle. Then high blood pressure, people land up in renal failure, and then get onto dialysis and brain hemorrhage and other things. These are the group of hypertensive heart disease causing left ventricular hypertrophy, heart failure, aneurysm, aneurysmal disorders, bleeding. These all becomes a hypertensive heart disease.
Correct, sir. So as rightly mentioned by you, that slowly the dysfunction and the glomerular nephritis and the dysfunction of the kidneys goes to a level where it is very chronic. So can you please elaborate how hypertension is associated with chronic kidney disease, the progression of chronic kidney disease?
Dr. Gupta will answer that.
Yes.
Yeah. So see, as I told previously, a chronic hypertension for long-standing period directly damages the blood vessels in the kidney, and it also damages the basic functioning part of the kidney, which is the filter of the kidney, that is called as nephron. Okay, so because of damage to the nephrons, there is reduced filtration, there is increased protein excretion into the urine, and this protein excretion and reduced filtration is kind of a vicious cycle, because the more the protein excretion in the urine, the more damage it causes to the kidney and the surrounding interstitial tissue of the kidney. So this is a vicious cycle which keeps on running, and when it is happening over years, when it is not controlled with proper medication, then this eventually leads to kidney failure and chronic kidney disease.
So
Yeah,
since
Anjali.
we have come to realize that hypertension is a common risk factor both for CVD and CKD. So my question to Dr. Kalmath is, what are some of the common risk factors, or who are at the more risk factors for developing this hypertension?
See, Ajay, you should divide it like who are likely to get essential hypertension. Even familial history or genetic history is very important. It can run in like diabetes, it can run in families. When both the mother, father are hypertensive, we are more common to get essential hypertension. And more important is nowadays is smoking, obesity, overweight, include eating this all this high salt intake, high salt food states, and then steroids, oral contraceptives, and people who take drugs, and people who are on some other toxic substance can develop hypertension. And unfortunately, some of the pregnant ladies can also become hypertensive because of that pregnancy itself. So, in nutshell, secondary causes for hypertension can be due to drugs, toxins, or pregnancy. Or rarely, it can be due to a congenital anatomy, we call coarctation aorta. Another major disorder is that some endocrinal or disease like cortisol disease, hyperadrenolesterolem's, and other kidney-related things, which Dr. Gupta will elaborate, they can cause hypertension. So these are secondary causes, which if you eliminate smoking, the high salt intake, many people need not take drugs at all. I mean, the pharmacological therapy. So the non-pharmacological therapy is that reduction of weight, reduction of salt intake, obesity reduction, alcohol reductions, and these all can reduce your hypertension to large extent. And people in stage 1 hypertension can go off antihypertensive drugs by just reducing all these just simple 5 things: reduction of weight, reduction of stopping of smoking, reduction of salt, and reduction of alcohol intake less than some we call 2 ounces, 3 ounces a week, and then and of course cessation of smoking. This can lead to a greater benefit of hypertension therapy.
So you rightly mentioned about the dietary intake. Like most of people in India, like we have a high salt intake, and most of our foods have a lot of masala, and what we eat outside is mostly processed food, which contains high salt. So my next question to Dr. Sachin Gupta is that how this high salt intake is specifically affecting the kidneys and leading to chronic kidney disease.
So the mechanism is very simple. If we take a high salt, definitely the blood pressure is going to increase in the body. So this increased pressure is transmitted to the kidney, the blood vessels into the kidney, the filter of the kidney, which is the nephrons. And this blood pressure will gradually, first thing is, will damage the vessel, will calcify the vessel, and it will increase the leakiness of the blood vessel, which will cause increase in protein. As I discussed previously, it will cause increased leakage of the protein. And this leakage of the protein is one of the most important factor of any disease, any kidney disease progression. So that is the reason that treatment of protein in the urine, treatment of protein in the to decrease the protein in the urine is the most important part of any treatment of kidney disease patient. And the main treatment is basically the antihypertensive medicine like telmisartan, olmesartan. So basically, once we reduce the blood pressure, the pressure into the kidneys is reduced, and that is the reason there is decrease in leakage of the proteins. And once there is decrease in leakage of the protein, so the further damage to the kidney is decreased. So that is so in any kidney disease patient management, first primary thing is management of and reduction in the protein in the urine through the help of the antihypertensive medicines.
Okay, sir. My next question to Dr. Kalmath sir is that, sir, you must be going to a lot of patients with established cardiovascular disease in your regular routine and with the associated hypertension. So, any recommendation regarding the optimal blood pressure target for patients who have an established cardiovascular disease?
No, yeah, established cardiovascular disease, we mean by that people already having myocardial infarction, angina, or angioplasty or bypass surgery, or whose left ventricles are. These people have to be very strict in controlling the blood pressure. Their blood pressure should maintain 130/80. Like Dr. Sachin told that telmisartan or olmesartan group are very important drugs called as ARBs, angiotensin receptor blockers, which are not only important in reduction of blood pressure, they also help in relieving the heart failure. Nowadays, we have gone one step ahead called as ARNI, a group of drug called as sacubitril and valsartan group of drugs, which are phenomenal drugs for controlling the blood pressure and heart failure put together. This is a great find of this decade, wherein the heart failure being treated very aggressively with these kind of drugs, along with the SGLT2 inhibitors, which are acting basically at the proximal convolutive fluid in the nephrons, which in very important diabetics or even non-diabetic heart failure patients. But in nutshell, established cardiovascular disease patients should control blood pressure more strictly, reduce their proteinuria, and control the lipids by taking statins, and also take antiplatelets and anti-cholesterol drugs in a very, very important fashion to keep all these four vices, the blood pressure, the diabetes, the cholesterol, and the weight reduction. With these can help in reduction of the further damage of the. Ultimately, all kidney patients, most of them, 80-90% patients die of heart disease, either a brain stroke or a heart stroke or heart failure. That's why kidney disease will ultimately affect the heart patients. That's why it should very important to combine both treatment.
Correct, sir. So mostly for all the patients who have CVD, they have to be in a strict control, and with the help of pharmacotherapy, they can maintain that control in their daily routine. So with that, I come to the next question with Dr. Sachin Gupta. Sir, for the patients with dialysis, you must be seeing a lot of patients with hypertension. So coming to that point, that for the patients who are on dialysis, what are your recommendations for those patients for the regular blood pressure checkup?
So see, whenever dialysis patient comes to the dialysis center, usually the blood pressure is checked. So usually twice or thrice a week, there is always a blood pressure checkup. But I would recommend the patients to see a nephrologist every 1 or 2 months. That is one important thing. Then when we come to the blood pressure exact levels, what we want in a patient. So there is a group called as KDOKI who gives us guidelines, for management of blood pressure. So they basically have set a target of BP of less than 140 and 90 in a dialysis patient before dialysis. So the patient, if he's going to dialysis, before the dialysis, the blood pressure should be around 140 to 90. And after dialysis, the blood pressure should be less than 130 and 80. Okay. But the guidelines usually keeps on changing every 2-3 years. But this is a general thing so that we can, just keep the managing the patient. And one important thing which Dr. Kalmath also told, that majority of the kidney patients die because of heart problems, mainly because of heart attacks. So that is the reason maintaining the blood pressure is one of the most important thing, in management of any kidney patient. Kidney disease cause heart problems, and heart patients have kidney disease. So it's both interrelated. So we need to manage both at the same time.
Right, sir. So with this, we come to a very interesting part of the session, where the whole agenda and the whole aim of this particular program is that bringing the cardio-renal expert and talking or discussing about hypertension as something which is interrelated to cardiovascular disease and the chronic kidney disease. So, sir, if you can, Dr. Kalmath, sir, if you can highlight a key take-home message to the audience, that how they can take proper care of their hypertension, to their caregivers, and also for the people who can prevent this hypertension from happening. So your take home message, sir, for the audience.
My take home message on the World Heart Day is very simple. Every year we have a great message for hypertension saying that control, take care of your heart, take care of your hypertension. But I would say simply, anybody who is above 15, 16 years should start their blood pressure checkup every year. I would say 15, 16 years, mind you that. We have young people of 18, 20 years having high blood pressure because many reasons. If you, God forbid, if you do not check and control their blood pressure, they can land a very. So everybody should check their sugars, blood pressure, and cholesterol from the age of 20 years, mind you. And it's mandatory. It's very mandatory after the age of 25 years every year. So unless you check your blood pressure, you never know you're hypertensive. And please check up with your general practitioner, doctors, to check your blood pressure in a quiet room, in a sitting position, and do not take any tea or coffee before checking your blood pressure. And for God's sake, do not get carried away myths that suppose you are diagnosed with hypertension at the age of 30, 35, this is going to be my lifelong tablet. Yes, but why are you taking this? Because you have a blood pressure which is uncontrolled, which is unseen and unpardonable. That's why you have to take the blood pressure tablet to control. And no blood pressure tablet is going to give any deleterious effect on your brain or kidneys. They have got 95% positive effects, except 5% side effects, which can be always controlled. So, my dear friends, please check your blood pressure, cholesterol, and blood sugar, and after 35 years heart every year without fail, to stay away from the great complications of high blood pressure in form of heart failure, myocardial infarction, and brain hemorrhage and strokes and kidney failure. That's my home takeaway message for you guys. Thank you.
So from the highlight from Dr. Kalmath's message is what we take is we need to take charge early, because a lot of young people are going through hypertension. People who are at the age of 16, 18 are also facing hypertension. So we need to take charge early. We need to comply to the therapy and stay away from the myths of hypertension, and take regular consultation and also check your blood pressure quite regularly. So, Dr. Sachin Gupta, I would like to ask you your key take-home message for the audience and a message on the occasion of World Hypertension.
So, see, from the kidney aspect, I would just want to tell you that around 30% of Indians have hypertension, and around 70 to 80% patients of kidney disease have hypertension. So you can see how prevalent is the hypertension in the kidney patients. Okay, so this makes management of hypertension very important. And as sir rightly told, we need to hit hard right from the start at a very early age. Nowadays, we even as sir told that we see hypertension in younger patients. Earlier, we used to see around up to 35, 40. Now we see people in their 20s also with BP of around 100, 210, 220, all those levels. So apart from maintaining a healthy lifestyle, maintaining a low calorie diet, low salt diet is very important. There is something called as primordial prevention, which states that if we right from the childhood, if we give low salt to the child, it has been shown to prevent the prevalence of hypertension later part in the life. Yeah, I know it's very difficult practically, but this is a very important part which I want people to follow if at all possible, because this can prevent a lot of future heart and kidney problems. Second is regular BP checkup and diabetes checkup. I've seen many patients, they are just on antihypertensive medicines for years and years. They are not showing to the doctor, they are not following up, they are not doing any blood test. And then we see after 10 years, the patient is having kidney problem. Had the same patient who had who has made a follow-up to the doctor and done few tests, the kidney problem would have been detected in the earlier stage. In that time, it was easily manageable. But once it progresses to a certain level, it's not easily manageable. That is the second thing which I want to highlight. So please make a proper follow-up with your doctor. And third is after 20 or 25, I would suggest yearly checkup, at least blood pressure checkup at least twice a year, and creatinine checkup for kidneys, urine checkup, and sugar checkup. This should be done at least once or twice a year, just as a preventive method, so that we can detect any diabetes, any blood pressure early, or any protein in the urine early in the life, and hence we can prevent the further damage to these organs.
Thank you so much, sir. The few points highlighted by Dr. Sachin Gupta for all the audience is that keeping a healthy lifestyle, one of the very interesting point that he mentioned is premodal prevention. That is, salt intake can be cut down since the beginning when the child is actually growing. So we can look for alternatives for salt and also having regular blood pressure checkups for everyone so that we can avoid the later complications in chronic kidney disease as well as one who can go through the cardiovascular disease. So with this we come to the end of the session, and I would like to give a vote of thanks on behalf of the entire team of Saffron to Dr. C Kalmath and Dr. Sachin Gupta for joining. Despite their very busy routine, they could join and share few insights, shows their inclination towards the patient awareness and their inclination towards doing something for the community. So thank you so much, sir, for joining in and sharing your
Thank you,
thoughts
Anjali.
about
Thank you,
this
Anjali.
World
Thank you.
Hypertension Day. And we'll be in touch to take this initiatives ahead. And we have the recorded session live where the other viewers can join in and take the messages from the same. Thank you so much, sir.
Thank you, Anjali. Thank you, Anjali. Thank you.
Very nice. Very nice.